So, keeping on to the same theme as we started off the program with male sexual dysfunction, PRP or P-shot is another method that can be used to improve this issue. So, can you explain to us what this P-shot is? Sorry.
Yes, P-shot we call P-shot when we are giving PRP, also platelet-rich plasma, as we explained earlier, in the cavernous tissue of the penis. So what does it mean? It means that we can deal with male erectile dysfunction in the way that we are locally injecting the growing factors, which are stimulating new blood vessels coming into the penis, and as a final effect of that is better male erection. Okay, so
there are many different reasons that a patient does actually suffer from erectile dysfunction. So a patient or a person who is suffering from these problems first should go to see their urologist to exclude other problems, because PRP is not going to solve erectile dysfunction across the board, right?
Yes, I fully agree with you. So we can maybe divide this patient in two groups. So we can divide this patient on the people who are not satisfied with erectile function, but they don't have really pathological problem, and we can put in other group patients who really have erectile dysfunction, so they are not functionally capable to have an erection. Yes, there are many factors which are bringing you to this factor. So of course we are suggesting every patient to be checked by urologist first, and then according that we will find a way how to treat it. So it's going to be.
So PRP is not good for, say, people who have this issue because of diabetes or high blood pressure or anything like that. That's not going to help.
No, I'm not saying no. It's actually opposite. It's going to help to that people because it will regenerate the blood vessels. So this is the group of people which we are dealing the most. So they are urologists knows better than me, but there are couple of issues of erectile dysfunction. Two of them are one is vascular problem, so we can treat it with PRP, and second is neural problem, also which can be improved, not treat. Maybe treat is not the appropriate word, but it can be improved with this kind of therapy.
Interesting. So once somebody who is a proper candidate for this treatment has it done, after how long would they be able to see an improvement or an effect?
First improvement after this therapy, a patient can see 3 to 4 weeks after therapy, and top of the result they can see after 2 or 3 months.
Okay, and of course the big question is, painful to have it done?
This treatment is done in local anesthesia, so with local anesthetic, so it's not painful since that you give just 2 injections, so you are filling up the cavernous tissue. It's just 2 injections, so it's not so painful procedure.
Okay, and does a patient have to have it done multiple times, or is it one time, or?
It depends of how big is the problem. So we are suggesting it to be done once in 3 months if we see improvement. So if the patient have improvement but it's not fully satisfied, he think that it can be better, we suggest it to repeat it every 3 months.
Interesting. So once again, then we've found out that with most problems there are solutions, and PRP or the P-shot might be a solution for erectile dysfunction in your case or your partner's case or somebody that you know. So again, if you do have any issue, communication is always key, to either be talking to or rather not either, but to also talk to your partner about it, and to be in touch with your urologist or doctor consent. In the case of sexual dysfunction, the first type of doctor that you would need to talk to is always a urologist. If you want to see any more information about these treatments, or to see it again, the whole explanation all over again, please follow us on our Facebook page, NIU YU. And thank you very much for watching.
She likes
glamour, runway, style, fame.
She likes fashion. She likes
boys, parties, style, fame.